Celebrities and social media influencers will be enlisted to help promote the coronavirus vaccine amid rising concerns over the spread of conspiracy theories online. Health bosses and ministers are in talks with responsible high-profile stars to post positive messages about the jab. No celebrities have been confirmed, but officials suggest Marcus Rashford, the England footballer campaigning to end child hunger, and members of the royal family would be ideal. There are fears that the torrent of anti-vax content on social media sites could lead to a low take-up of the vaccine, affecting the chances of achieving herd immunity. A recent survey in the US and UK found that public willingness to take a COVID vaccine fell by 6.4% after reading anti-vax posts. Under the plans, well-known television doctors will be enlisted, as well as figures with large following on social media, The Guardian reported. Religious and community leaders are also being consulted in order to allay possible fears over the vaccine among Black, Asian and ethnic minorities. The government refused to provide details, but a source said officials are working closely with Public Health England and NHS England and Improvement to provide authoritative information to the public. The army has already mobilized an information warfare unit to fight anti-vax propaganda. A Boots nasal spray for colds and flu is being tested to see whether it can stop coronavirus infection, thanks to a special seaweed ingredient. Researchers at Swansea University begin human trials today following a successful laboratory study of the over-the-counter remedy, which costs £5.99 for 20 millilitres. They hope Boots Dual Defence nasal spray will prevent infection, or reduce the severity of symptoms if people do catch COVID-19. The key ingredient is based on carrageenan, a red edible seaweed that was used to treat respiratory ailments in 19th century Ireland. For the Boots spray, it is sourced from Zanzibar and the Philippines. The dual defense formulation is made by the Austrian firm Aranomed, and Boots is the only British company licensed to sell it. The results of tests on 480 health workers are expected to be published in March. Researchers hope the drug can be used to tide people over until they are vaccinated. Lead investigator Dr. Zita Jessup said, "We wanted to find a way to help protect frontline NHS staff. If the results of this clinical trial are as positive as we expect, it is potentially another weapon in the armory." Soldiers from the Defense Cultural Specialist Unit, launched in Afghanistan in 2010, are analyzing how Britons are being targeted online. The troops, who belong to the 77th Brigade, are sizing up the level of vaccine-related disinformation from hostile states such as Russia, according to the Sunday Times. The mass rollout of COVID-19 vaccine will transform the UK into a whole new world by the spring, Foreign Secretary Dominic Raab said yesterday. The vaccine will, by then, have been distributed to key workers and the most vulnerable, particularly by age, he said. Optimism over the jab, which is due to be approved by UK regulators within days, had allowed the government to plan its exit strategy from the pandemic. His positive assessment came as Downing Street announced a £20 million fund to expand the UK's ability to produce medicines and diagnostic equipment. Hospitals across the country have been told they could receive large stocks of the front-running vaccine as early as next Monday. The vaccine, produced by US drugs giant Pfizer with German firm BioNTech, has recorded a 95% success rate in trials. The UK's Medicines and Healthcare Products Regulatory Agency is reportedly ready to give it the green light this week, making the UK the first Western country to approve a COVID vaccine. The government has secured 40 million doses of the Pfizer vaccine, but they will be challenging to roll out, given the need to store them at temperatures of 70 C, 94 F. The medicines regulator was asked by ministers last week to review the vaccine developed by AstraZeneca and Oxford University, of which the government has ordered 100 million doses. The Oxford team said last week that, overall, a trial suggested their vaccine gave 70% protection. But an initial lower dose for the first of the two jabs required would raise that protection to 90%. The UK has also ordered 5 million doses of a vaccine being developed by US firm Moderna. Yesterday Boris Johnson launched a capital investment scheme aimed at stimulating the development of medicines in the UK, saying the £20 million fund would equip us to fight future health crises. It comes amid concerns from experts that a breakdown in Brexit trade deal negotiations could affect the supply of medicines.